Hello everybody and welcome to Focus on Fitness, a program co-produced by the Fayette County Public Schools and UK Healthcare. The subject of this month's program is the dreaded ACL tear, and we're going to learn about that, what the ACL is and the injury and ways to prevent the injury from occurring. And our guest today is Dr. Darren Johnson, Professor and Chairman of Orthopaedic Surgery and the Director of Sports Medicine for the University of Kentucky School of Medicine. And I must add to that, one of the leading authorities on the ACL injury in this country. And Darren, it's a pleasure to have you on the program.
Thank you very much. Look forward to being here and participating.
Let's start out very simply. What is the ACL and why is it so critical to athletic performance?
Well, the anterior cruciate ligament is one of 4 ligaments in your knee. It's the main stabilizing ligament that prevents your shin bone from moving forward on your thigh bone and helps prevent rotation. It is not the most commonly injured knee ligament, but it's the one we hear the most about when we click on ESPN or we pick up the local sports page, just because the prevalence of the injury as well as the ramifications once you tear it. For season out, you have surgery. So nowadays in 2009, most athletes, parents are very familiar with the dreaded 3-letter word, we call it, that we're all familiar with.
And why, and you kind of touched on it there, but I mean, when you do hear it, you kind of cringe. We use the word dreaded to describe it. Why is it so devastating?
Well, I think, because it is a ligament that enables athletes or even the athletically active. So it not necessarily is the high school, collegiate, professional athlete that we usually read about it in the paper, but it can be yourself, the neighbor who participates in, soccer on an adult soccer team that tears their ACL. But the reason we use the word dreaded is because in general, if you want to go back and participate in those same sports that you did before the injury, then that means surgery and a year-long commitment in rehabilitation to get yourself back to participating at the same level you did before the injury, as opposed to a ankle sprain or the other common things we get that, you're back in a few weeks. So this injury is, we call it a serious knee ligament injury. It means surgery, rehabilitation, and probably the worst thing for the athlete is time off, right, which not too many kids, athletes like to hear.
Right. What are the causes? How does this injury occur?
This injury occurs, most people are concerned about their children participating in contact or collision sports. And believe it or not, that most of these injuries, more than 50% of these injuries, are caused by a non-contact mechanism. And what we mean by that is that it's not the dreaded crunch that you watch in the football game and everybody kind of goes, whoa. This is really an injury that non-contact mechanism, foot gets planted, so the foot has to be planted. And then for some reason, whether it be you're coming down from a header in soccer, you're running side to side and you get a little bump, and there's a lack of coordination in the system, and for a brief instant, your knee sort of does this and comes back, and boom, your ACL's torn. So most commonly it's non-contact. Athlete falls to the ground. Sometimes they get up. They don't even know they tore their ACL. So that's a common thing where, Dr. Johnson, I didn't even really feel anything. So it happens in a millisecond, and then the whole cascade of things happen later on. So non-contact, little muscle incoordination, you got hit, an uncoordinated maneuver. that your body's not typically used to, and the buckle happens. We call it the double fist sign that the athlete will often show you. They'll come into the office and they'll go, you know, my knee kind of felt like it did this, and that's all it takes. It can be that simple.
So you mentioned an uncoordinated movement, and this is from folks that are usually very coordinated, but it's just one of those, like you said, moments where it's hard to describe.
It's a brief second that they maybe, you know, put their extremity out there in a position that the brain doesn't quite register yet, or the signal coming down from the brain to the muscle mass in your leg is a little bit delayed. So in other words, you put your leg out there, stop a ball, plant your foot. Typically it's a foot plant, or you put it out there, and the signal coming down to the muscle group to, uh-oh, I got to get ready for this, maybe is just a little bit delayed, so that knee ligament is now in an unsafe position and it gets torn. That's how simple it can be.
Wow. Now I know, I've been told that there's an increasing frequency in this injury occurring in female athletes.
Right.
Particularly, as we've talked about here briefly, soccer players. Why is that?
Well, I mean, if you look at the numbers, you know, we didn't see this before Title IX. So Title IX came about, and you had a massive increase in the number of females participating in sports at the collegiate level. Well, naturally, that filters down to the high schools and other sports. So today, in 2009, you have, you know, probably as many females participating in soccer, basketball, lacrosse, rugby, as males, particularly at the high school and collegiate level. And what we have found over the last, 20 to 30 years since Title IX is about a 4 to 8 times increase in ACL injuries in the females compared to the males. Now, this specifically looks at soccer, basketball, volleyball, rugby, lacrosse, those types of sports. And naturally, the next question is, well, why is that? Well, why? What are we doing wrong, or what's wrong with the females, or what can we do? And there's probably a number of different things going on. It's not just one thing that we could probably put our hands on and prevent. Are females built different than males? Yes, they are. So is there an anatomy factor? Absolutely. Can we change anatomy? I don't think so. Are there coordination things in terms of jumping and landing that we have looked at that are definitely different than males? Absolutely. When we look at basketball, we see that, for instance, when females come down from a rebound or a header in soccer, they tend not to flex their knee as much, and they're more upright, which puts your ACL in a more at-risk position.